Welcome back, Titans, to another episode of EMS Lecture Series for St. Pete College's EMT and paramedic programs. Today in pharmacology, we're going to review Norepi, also commonly known as the brand name Levofed. We're going to go over the classes, the indications, contraindications, your dose per the Nancy Caroline book. And we're also going to, towards the end of the video, show you how to mix it and prepare it for your patient to be delivered. So what is Norepi? So Norepi is a sympathomimetic and a vasopressor, commonly found post-cardiac arrest or in a septicemia patient where we need to increase the patient's blood pressure. How does it work? So the mechanism of action for our Norepi, it acts on the alpha adrenergic receptors and it produces a constriction of restriction of resistance and capacitate vessels. So what does that mean? It increases the systemic blood pressure and coronary blood flow. That's our goal for our patient. That's what the medication does. That's why we are going to be delivering it. Now you have to know that in lower doses, the cardiac stimulant effect predominates when we're giving Norepi. But in the higher doses, the vasoconstrictor effect predominates. So something to keep in mind, low dose versus your high dose. What are our indications? Like we said before, it's a vasopressor, so we know we're trying to do something with our blood pressure, usually get the blood pressure up. So it is the first line pressor in a neurogenic shock and hypotension that is unresponsive to IV IO fluid resuscitation. We've been giving our patients fluids, their blood pressure is not increasing. After a certain time period per your local protocol, we need to consider using a pressor, if not going to a pressor immediately. What if anytime we have an indication, we have a contraindication? So the contraindication is obviously anytime we have a medication we're going to be delivering, we're doing a cross-check to make sure that they don't have an allergy to this and that it's a correct dose. But if they have a hypersensitivity, we're going to stay away from it. Also, anytime you have a hypotension caused by hypovolemia, it also says in the Nancy Caroline book that pregnancy is a contraindication, but it's relative to the situation. Do a consult or what have you. So, are there any adverse effects? So potentially with any medication you give, there could potentially be an adverse effect. For Norepi in general, you could have headache, nausea, vomiting, increased blood pressure, obviously, because that's where we're giving it. You could have a lower blood flow to your GI tract. We could have renal problems, peripheral cyanosis, or even cardiac arrest. There's a whole list of them in the Nancy Caroline book. I recommend you go check those out. What about the interactions with other medications? So tricyclic antidepressants, TCAs, can increase the response to pressors and inactivated by alkaline solutions. So if you mix this into an alkaline solution, it's going to inactivate your medication. And also keep in mind that anytime you're stacking sympathomimetics, because Norepi is a sympathomimetic, it could increase your heart rate and blood pressure because it's working almost like double time. You're giving double the amount of sympathomimetics. So keep that in mind when you're doing that. Our dose. So our dose is 0.1 to 0.5 micrograms per kilogram per minute. And this can be given the IV or IO route. And this is a medication that we're going to titrate to effect. We're going to start typically lower and we're going to work our way up till we get our desired effect, whether that be a systolic blood pressure or what have you. Duration of action. Duration of action is going to be, the onset is immediately. Our peak time is going to be less than a minute for the peak amount of effectiveness of this drug. And then the duration is going to last about 1 to 2 minutes. So that's why we are titrating this drug, and that's why it's a slow, continuous drip of this medication, because it's so short acting. We want a continuous flow of this medication to maintain that patient's blood pressure and do what we want it to do. Any special considerations? So it's a pregnancy category C. Nancy Caroline also recommends that a large, stable vein is recommended when you're delivering this medication. We do that because we want to use caution that if the vein blows and we start infiltrating this drug into our patient, it could be necrotic for them and their tissues. Drug or poison induced hypotension, you may need a higher dose of Norepi. So keep that in mind. And then also keep in mind that cardiogenic and septic shock with Norepi has been shown to have a less of a mortality rate than, say, dopamine. So, quick overview of Norepi, Levofed, and let's mix it. All right, Titans, so we've decided that we need to give our patient Norepi. We're post-code, we have a septic patient, we've done our cross-check, our rights, and we know our indications, contraindications, all that. So we remember that from earlier in the video, Nancy Caroline said our dose for Norepi is 0.1 micrograms to 0.5 micrograms per key per minute. Now keep in mind our dose is going to be in micrograms, and for this example where we typically see it is Levofed comes in milligrams, 4 milligrams and 4 mLs. So from an earlier video, we know that 1 milligram is equal to 1,000 micrograms. So if we have 4 milligrams of Norepi in our bottle, we know that is the same as 4,000 micrograms, just written different. We used pounds of feathers and pounds of bricks as an example in class. You can have a pound of bricks and a pound of feathers and they are the same weight. There's going to be a lot more feathers, but it's the exact same thing as a pound of bricks, if that makes sense. So we are going to put the entirety of our 4 milligrams into a 1,000 ml bag. So we have 4,000 micrograms, which is the whole 4 milligrams, into our IV bag. Now we need to find the concentration. Well, if I have 4,000 micrograms and 1,000 mLs and I divide it, all I'm doing is taking away my zeros, and now I have 4 micrograms for every ml. We're going to be using a 10-drop set for this example, and I know that each 10 drops equals 1 ml. So if I have 10 drops to equal 1 ml, I know that I need 10 drops to give me the 4 micrograms. So let's put it into a patient. So starting with, we'll say an 80 kilogram patient, we're just going to plug it in. Let's start with 0.1 micrograms per our 80 kilograms, and that's per minute. All we have to do is multiply 0.1 by our 80, or you can, because it's 1/10, you can move the decimal place over. That's going to equal 8 micrograms per minute. That's what I want to achieve now. That's the 0.1 micrograms per key per minute. It's going to be 8 micrograms. Now we said each ml contains 4 micrograms. So if I need 8, I just have to double it. So I need to be delivering 2 mLs per minute to my patient. Going back to our drip set, I need 10 drops to equal 1 ml. So all I have to do is multiply what I need by my drip set. And if I do 20 drops, it's going to give me 2 mLs per minute. So that's going to be 20 drops a minute. That's what my drip is going to start at, and that's going to achieve my 8 micrograms per minute. Say you had a 20 drop set. All you have to do is double this up. Now it's going to be 40 drops a minute. Or say you wanted to double up on your dose. You're just increasing the drops, and it's going to also increase the amount of micrograms you're delivering per minute. Hope this helps. See you on the next one.